Welcome to our Hope Treatment. This is the place where your mental health becomes our priority. We receive a lot of questions regarding PrTMS treatments, and we decided to create a video which is going to be step-by-step experience for you. We're going to show you what kind of technology is behind this treatment, and also you will have a chance to meet our Dr. Starck, our leading physician, also our TMS technician, Yelena. Enjoy. Hi, I'm here with Dr. Starck, and we're going to try to explain you how the initial consultation works with our Hope treatment. Normally, the first contact would be me, and we're going to have a small talk about what exactly is the problem, what kind of symptoms you have, what did you try so far, what worked well, what didn't work, and I guess the next step would lead to us explaining you what kind of technology we are using, what you can expect from us, and of course the price for the treatment and the payment options. If we are on the same page here, then we can schedule a phone call consultation with Dr. Starck.
The rest of the conversation would really involve more detail on the medical history, more detail on the mental health history. Again, a little bit more detail on the pharmacologic treatments that have been tried, the results, and really what your clinical goals and expectations are of the treatment. We want to make sure that we can meet your needs and meet your expectations, and so we would really want to be able to articulate those. The conversation typically lasts maybe 15 or 20 minutes. I'm available to answer any questions. Sometimes the initial conversation with Marco will trigger some additional questions or concerns that I'm able to answer. And then the next steps would be for you to come in to our clinic, see our facility, and complete a more formalized intake. So we will be collecting neurocognitive survey data for each of our patients. We have a set of standard surveys that are completed for all of our patients for general anxiety, depression, and sleep quality. We have an extensive list of other neurocognitive tests that are part of the assessment process and the monitoring of the effectiveness of treatment. So based on diagnosis, we would include surveys for ADHD, autism, both child, adolescent, and adults, cerebral palsy, quality of life questionnaire, concussion symptom inventory, neurobehavioral symptoms, PTSD checklist, and the tinnitus and hearing and sound survey, as well as the headache inventory. This is a really essential part of our intake and assessment process, followed by, and these are completed on our iPad, so this is an electronic data input that we will collect on a weekly basis. And again, we not only track, but we also share with our patients so that we can document and review with them the improvements in their symptoms. The second phase of our intake or assessment process is our EEG. This is a high technology, highly sensitive, gel-less, wireless EEG cap that collects the data that's transmitted to our founding organization called Peak Logic, which is the application that's used to actually develop the treatment protocols based on EEG input, the neurocognitive survey details, and through an AI algorithm develops the treatment, personalized treatment, and adjust the treatment on a weekly basis. I'm going to now take this opportunity to show you what the EEG cap looks like, and we will actually perform an EEG so you can kind of have an idea of what you would experience coming here to our clinic. So we've completed the orientation of the EEG cap. We have documented the connections are in place. We have a visual of the cap amperage, and we are now actually ready to begin recording the EEG. So now we have the opportunity to share with you what the actual treatment process looks like. We have a protocol that's developed through the AI mechanism, taking in the EEG and the neurocognitive survey results that we talked about previously. We have, in this case, a 6-position treatment protocol where the magnet will be placed in 6 different locations on Yelena's head. Yelena, again, has allowed us the opportunity to use her as a model for this demonstration.